Okay, so this paper right here, this is how we do our report at my job. So basically you have name and room number. So basically we just put the room numbers in these blocks right here. And then also if I want to know if my patient is got a fracture hip, or if basically they have aphasia, um, or anything else, anything important I need to know, or if they got dementia, that'd be very helpful. I put it in this block right here. Another thing is this is the diet right here. So NPO means nothing by mouth. Then you got D1, D2, and D3. That's dysphagia. So I in another video I'll tell you what D1, D2, and D3 is. But I want to know if I want to know that that's part of their diet. I want to know if they're a regular diet, they're a feeder, full supervision. I want to know if my person is a full supervision. That way, when I pass trays out at towards the end of my shift on breakfast, I want to know if they are full supervision. That means full supervision means they have to be fed by somebody. Um, Intimate supervision. They could some people could feed themselves, or they might need a little help, but you still have to sit there and watch them, just in case they don't choke or pocketed food inside their mouth. Um, that's very helpful. Or if they are set up, then if I got to set their tray up, then that's very helpful as well. Um, this right here is CBG and and weight. So I want to know my person is ACHS, which means they are diabetic. I want to know if they a Q4 sugar, a Q4 CBG. That means I want to know if I gotta check the sugar every 4 hours. So when I come in at 7, they would need to get their sugar taken by 8. The next time I would take their sugar will be 12, and then the last time I would take it would be 4 in the morning. Um, Q6 hour sugar. That means you do it every 6 hours. Do it once every 6 hours. AM. I rarely have anybody who's Q6 sugar or AM, but AM. That means you taking their sugar, do it the morning time. Daily weight. I want to know if I have to get their weight by the end of my shift. Vitals. Q4 vitals means taking their vitals every 4 hours. We would use this right here if they on the telemetry, which is the heart monitor. That's very important. Muse means if it's yellow or red, that means they was having some difficulty with they blood pressure. So I want to make sure or with the temperature. So I want to make sure I check they vital signs every time frame. Like it'll probably be like kind of like a Q4, but a little different. So I could report to the next person or the next nurse that they blood pressure was taken every certain amount of time to see how they if their blood pressure is really high or low. And you do the meals, you do it like for 24 hours, the first 24 hours on my shift and on the and day shift until it turns green. Um, Q shift means like once a shift. They get their vitals done once a shift. Um, there is rarely I have somebody that's like Q shift vital. That'll probably be like probably somebody on the telemetry floor, but I rarely have anybody who's like a Q shift vital. Ortho vitals is when I have to take they vital signs when they sitting down, standing up, or lying down. Um, so the transfers, I want to know if my person needs to if they use a roller walker to transfer back and forth to the bed to the bathroom, if they pivot or do a stand pivot. MATSI, if MATSI means kind of like total care. Sarah slide, I'd rather have anybody do Sarah slide. You will hear the term slide board, which is like a board that you put underneath the person, and then they slide to the bed or to the wheelchair, in and out the wheelchair. Handheld means you hold that person's hand while they go into the bathroom or transfer, go to the bed or wherever. I want to know for the assist. I want to know if it's gonna take just one person, which is me, or it's two persons, or if they like on a steady. Steady is kind of like a wheelchair on wheels. It's kind of like a wheelchair on wheels, or in a way kind of like towards it's like a chair on wheels. I want to say a Hoyer lift in a way, but on wheels. Hygiene, if they on Foley, if they have a Foley, I want to do I want to know if they need Foley care. CHG, I want to know if they got a PICC line, whether they on the whether they're a dialysis patient, they got like the port, the PICC line, or the center line. I want to know if I got to do the CHG bathroom. Night bath, once in the blue moon, I would have somebody that, if they like total care or something, or or they want to just get washed up at nighttime. Then that's what that'd be for. Then for the devices, catheter. I want to know if they have a catheter. An ostomy bag, if I got emptied out. Hand sprints, if I got put hand sprints on them. Boots, I call them the Moo boots. I want to know if I have to put those on. SCDs are like they kind of like a device that you put around the calves of your legs, and then it's connected to a machine. It stimulates the blood flow on their legs, and it keeps the swelling down. I want to know if I got put SEDs on them. TEDs, we call them the TED hose. I want to know if they wearing TEDs. The next block would be dentures, teeth. I want to know if they got dentures, if I got to take them out. Hearing aids. I want to know if they have hearing aids. Telesitter would be, if you're not familiar with a telesitter, it would be it'd be somebody like on a camera. It's like a camera or a pole in somebody's room to watch the patient, to make sure the patient is safe. We do have on my floor on the rehab hall, we do have people who try to get up out the bed. We deal with people with brain injuries, spinal cords, people who've been in car accidents, you name it. Anybody who needs, we have special help, but we do have people who have telecells to make sure somebody's watching them on a camera that will let us know by calling us to let us know, hey, such and such is moving, try to get out the bed or wherever. Restraints, I want to know if my patient has restraints. Also for, let's see, skin reposition, I want to know if I got to reposition my person like every 2 hours, or 4 hours or whatever. But most of the part, it'd be 2 hours. Float heels. I want to make sure if I got to float my patient's heels. Dressing. I'd rather have anybody with dressing, but I want to know if, for some reason, if I need to know my person has a dressing. That's very important. Cream. I want to know if my person has like a barrier cream or some type of motion cream or skin cream. Elbow. I want to know if I got to make sure they float their elbows, their arms on a pillow. Also for this, bowel and bladder, I want to make sure, I want to know if my patient, very important, if my patient is continent, whether they continent times 2 or they continent, I want to know if they incontinent. Some of my patients do be continent/incontinent. That means they could be continent during the daytime, and then at night they'll have like incontinent episodes. That's very important. I want to know if my person is an in and out calf. If I need to do a in and out calf on them. If I also want to know if they are PVR. If I need to scan their blood to make sure they see how much fluid their bladder is retaining. Also, a regular blood scan. Torting, I want to know if I got towards them every 2 hours, 3 hours, or 4. That's basically about it in that one. But it's like 10 spots for the rooms, like 5 on the front page and 5 on the back. So that's basically how we get a report on my floor. And that's all I want to know. If y'all have any questions or whatever, just let me know. Thank you.